Thanks for joining us.
Talkline Network Radio, America's longest-running Jewish broadcast network, the voice of the Jewish community.
Welcome to the podcast. You are now tuned in to this episode of our podcast. Today, we are going to interview some of the greatest and most influential minds in our field. And now, please welcome your host.
You're listening to Talkline with Zev Brenner, America's premier Jewish broadcast on the air since 1981.
Welcome back to the program. I'm Zev Brenner. So glad you're joining us. And we're speaking right now with Dr. Kendra Ray, Dementia Program Director at MJHS Menorah Center for Rehabilitation and Nursing Care. Thank you for joining us.
Thank you so much for having me today.
Our pleasure. So you are a board-certified music therapist. Why are you so passionate about helping people with dementia?
You know, I started over 20 years ago as a music therapist working in a psychiatric setting. And about 5 years into my career, my dad had a stroke, which made it so that he ended up with vascular dementia. And since then, I've been really passionate about helping people who have all types of dementia, including Alzheimer's disease. And over the past 15 years at Menorah, I've been conducting research on the use of music therapy for people with dementia.
Is it a growing problem, by the way? I think we're hearing more and more people getting dementia and getting it earlier and earlier.
You are right. There are about 6 million people in the United States who are living with Alzheimer's disease and other related dementias, and there are about 410,000 people in the state of New York who have AD or another type of dementia. We are seeing at least where I'm working in the nursing home, we are seeing more and more people who are diagnosed earlier. So you're absolutely right. And I think everybody knows someone who's affected by the disease.
Unfortunately, so many people are affected by it. In fact, this memory loss affects so many people around the world. Can you tell us, doctor, what are some of the early signs and symptoms of Alzheimer's?
You know, if you find that your memory loss is affecting your everyday life, that's definitely a sign. It's important to know that forgetfulness can be a part of normal, healthy aging. So there's no need to panic. But if, you're at a point where you feel like you lost your keys, that's okay. But if you don't know what to do with your keys, that's when you have to really start thinking about, is my memory really affecting me?
If I forget my name, I'm in trouble, right?
Yes, yes.
Now, you are at the MJHS Menorah Center for Rehabilitation and Nursing Care. How do you deal with some of these Alzheimer issues and memory care needs of residents?
So we have nearly 270 of our 436 residents who come to us with some sort of memory impairment. And so we do have a specialized unit at the MJHS Menorah Center that focuses specifically on people who have moderate to late stage dementia. And our residents take part in creative arts therapies. And this started after, I had done some studies and research that showed that music therapy and other creative art therapies was really beneficial for people with dementia, specifically helping them with their symptoms like depression and agitation.
Wow. Now, from what I understand, MJHS Menorah Center is the last not-for-profit Jewish nursing home in Brooklyn with unique programming for Holocaust survivors, which is unfortunately a shrinking group. Can you tell our audience about the current art exhibit and how you and your team use art, music, other therapeutic activities to care for people who survive trauma?
Absolutely. We do have a fabulous art exhibition that is being displayed right now. And it's featuring the works of our residents who are Holocaust survivors. We found that in our activities using therapeutic art, that it really helps the residents to demonstrate their resilience and the hope that they still have. And the exhibit is a good example of our approach using person-centered, trauma-informed care. We started showcasing the artwork of our residents this past July, we did have a grand opening of the Residents Arc, and it really has sparked a lot of conversations between our residents and their family members.
Now, dealing and caring for people with dementia, it's no secret you need to have specialized training. You have to have compassion, lots of patience, right? You've collaborated with people all over the world, including from Israel, about how to incorporate music into everyday activities. What are some of the things that you teach clinicians, including nurses' aides, to deal with this situation?
Absolutely. And I have to start by saying that even though I've taught a lot of people, I've learned even more from people, especially from Israel. I have a colleague who's a music therapist over in Israel, and she's taught me a lot as well. I will just say there are 3 key lessons that, I think about on a daily basis. Compassion first should be at the center of how people think about caring for a person with with dementia. It might seem obvious, but a lot of people forget to introduce themselves and say, "Hi, my name is Kendra. Today I'll be taking care of you. I'll be providing music for you, or I'll be helping you with your meal." So really thinking about how you're approaching a person, not forgetting who the person is, and there's still a person inside, even though they might be dealing with memory issues. And secondly, we talk a lot with our staff members about using singing. And at first, I've noticed lots of people are hesitant and they say, "You know what, I can't sing, I can't sing." But we found, in our research, and then other people have found as well, that you don't have to have a voice like Barbra Streisand or someone else famous. You can still sing. It's a very effective intervention. A caregiver can do it, a music therapist can do it, and it can really help an individual who has dementia to calm down. And
How does music help them calm down?
If you use music that might be upbeat and you find that the person is agitated, you might start with a really fast-paced song, and then eventually slow the music down. Music affects a person's heart rate. It affects their pulse. It affects their perspiration rate. And their blood pressure. So if you're using music, intentionally, thinking about tempo, thinking about volume, you can use music to help a person to relax. And especially it's for people with dementia, you want to use music that's familiar to them. So a lot of people who have dementia still remember songs from their childhood or remember songs that was popular in their 20s and 30s. So, being intentional about the types of music helps as well.
Fascinating. Now, a diagnosis of dementia impacts the entire family. It's no secret that it has a tremendous impact. I understand you have preliminary findings from a study with home-based family caregivers. What are some of the takeaways that you've gotten from that study?
Right. So we did receive a generous grant from the Alzheimer's Association to look at how music that is facilitated by a family caregiver can help. And we have found in our preliminary findings that music that is used on a daily basis or even twice a week can have a really strong impact on caregivers. We're finding that caregivers are reporting that they're less burdened, they feel less distress. The individuals with dementia are showing increased and improved quality of life and decreases in neuropsychiatric symptoms like agitation or irritability. And many are even reporting that they're having better sleep at night.
And do patients sometimes sing along if they recognize the music? Is that something which you find takes place quite often?
Absolutely. I will say this. It's so interesting when, people come to us and the staff have said that they're nonverbal. They're not speaking anymore because of their diagnosis of dementia. And we found that over time, introducing music that's familiar to them again, or that might have an emotional connection with them, allows many people who are nonverbal to start singing. And then we have those who sang all their lives who are the loudest people in their music therapy groups. So definitely singing is a really impactful. intervention.
Fascinating. I want to thank you. Dr. Kendra Ray is Dementia Program Director at MJHS Menorah Center for Rehabilitation and Nursing Care in Brooklyn. Thank you for joining us. We hope you join us again.
Thank you. Thanks for having me.
Thank you for tuning in to
Talkline with Zev Brenner, America's premier Jewish broadcast, the pulse beat of the Jewish community.
For continuous Jewish programs, talklinenetwork.com, or our 24-hour-a-day listen line at 641-741-0389. For past shows, you can find us on iTunes, Spotify, Amazon, YouTube, Instagram, and all major podcast platforms, or jewishpodcast.org. Thanks for listening to the talklinenetwork.com.
Follow us on Facebook, Twitter, and Instagram.